A very good evening to all of you who have joined us today for this webinar day 3. And I here welcome you all to the webinar series on homeopathy or holistic healing by CAR study group, that is Kavitha Holistic Approach, in collaboration with Homeopathy 360. So I, Dr. Yashika Arora, heartily welcome you all to the session of the day, and I will be the moderator for today's session for all of you. So, before we begin the session, I hope everybody is excited to learn from a young, dynamic speaker who is also an inspiration for many of the upcoming homeopaths. So, before we begin the session, want to introduce you to the CAR study group as well as Homeopathy 360, and I would like to welcome our dignitaries and the chairpersons of today's session, Dr. Kavitha Kukunoor, ma'am, and Professor Regina, ma'am. I welcome you both to the session of the today. So thank you so much for joining us, and I would like to introduce you and present my thanks to Mr. Manish Jain, the director of Vision Publishers, who is behind this webinar series as well as have given us this platform to organize this series and collaborated. Also, I'm thankful to CAR Study Group, that is Kavitha Holistic Approach, for giving Homeopathy 360 this opportunity to collaborate with them and organize this webinar series. I hope this becomes a success and we get a good audience as well as we people get some good knowledge and a different knowledge from this webinar series. So thank you all of you, and I request all the people to kindly visit the website of www.kavithahomeo.com as well as www.homeopathy360.com, and follow us on our social portals of Facebook and Twitter and Instagram handles. We regularly update about homeopathy as well as all our updates on our social portals. As well as on behalf of Homeopathy 360, I would like to invite all of you to submit your articles, your research papers, or anything you want to get published regarding homeopathy. So I would like to welcome all, as well as for our peer-reviewed journal, the Homeopathic Heritage, you can submit the articles. So we'll be happy to publish the same, and also I would like to update about that about the CAR family and study group that is working hard to promote homeopathy through various means, and trying to organize these webinars as well as update education, promoting education and knowledge on different aspects, regular CMEs and regular case discussions and everything. They are trying their level best to bring homeopathy to a different level through their initiatives. So I hope if you have any queries regarding the CAR study group or Homeopathy 360, you can mail us on the given email IDs on the brochures, and we welcome you all to this webinar. And now I would like to I take this privilege to introduce you to Dr. Kavitha Kukunoor, ma'am. As you all know, she was our first day speaker, and we got to learn from her a lot. And she's practicing homeopathy since 1995 and currently located in Michigan as a practicing homeopath. And she has a lot of if you talk about the qualities, so she is very down to earth personality, and it feels so great to know her. And she has achieved so much. Still, she is so sweet and humble, always trying to always talking so she's so soft spoken and helping out everybody through different means. So I welcome her. She is the president and CEO of Kavitha Holistic Approach and the founder of CAST Homeopathy Study Group. She has served Homeopathy World Community HWC pro bono for 10 years, and has also served as an outreach coordinator of CHC PR committee. She is the certified HP supervisor in homeoprophylaxis from Free and Healthy Children International, and also the board certified alternative medical practitioner from American Association of Alternative Medicine. So here I welcome her, and I would like to request her to say a few words before we begin this session of the day. Over to you, ma'am.
Thank you so much, Yashika. So sweet of you, all the qualities you have. Okay. I want to thank sincerely Dr. Yashika, Managing and Content Developer, Manish Jain, the Managing Director, and Homeopathy 360 team for giving this great opportunity to share holistic approaches of healing through energy medicine. Whenever we hear Homeopathy 360, the first person who comes to our mind is Dr. Yashika. She's so soft, sweet, kind, dynamic lady working very hard executing many things for the organization and many more organizations. Doing all this is not easy apart from handling our practice,
She's
taking
probably
care of.
having connection problems because I see her online on WhatsApp and here it's not connecting. And
You can hear me or no?
I hope she's back.
Can you all hear me?
Yes, ma'am, you
You
can
are audible
continue.
to me, ma'am.
Perfectly fine. It's perfectly fine. Yes, ma'am.
Okay, thank you.
Yes. Kavitha Kukunoor, she is a very kind and generous and knowledgeable homeopath, and she's working in Michigan, USA, and is working along with her hubby and family at the Carvings Friendly Foundation that helps in many other social and charity purposes throughout North America and India, and helping with the offering food supplies and technology and courses to people that are in greater needs. And
Thank you, Regina.
I take the opportunity of being blessed to be an advisor of Ka Family Homeopathy Study Group, and where we study materia médica, case studies, and we have these seminars that are free to everybody so they can get together with like-minded people and have the opportunity of exchanging knowledge and after being in togetherness, give back to their communities. So it's a way to embrace the whole world through waves of awareness. Today, we are having the PhD scholar, Dr. Shweta Singh. She's talking about dermatology. So it's a bless to have her around. She is administrator of Ka Family Homeopathy Study Group, and she's behind the whole um, structure of everything. She offers beautiful certificates and provides her knowledge at the study group. So today we are having homeopathy in dermatology, a holistic way of healing. So thank you for this great opportunity. It's been a bless. Namaskarans. Om Shanti.
Thank you so much, ma'am. Thank you so much, ma'am. I would request Dr. Kavitha, ma'am, to please speak a few words.
Thank you, Professor Regina. I had some internet issues, and thank you for having a very good description about Dr. Shweta. So I would like to say few more things about Dr. Shweta, and she's a very highly qualified homeopath, and she's a core member of Orbit Clinics since 2014, as well as Ka Homeopathy Study Group, and she graduated with BHMS in 2011, one of the reputed colleges, Delhi.
She says
And
she's in there
yeah, she's here.
and she can hear all of us.
Ma'am, Dr. Regina, ma'am, please reload your page once. I think there was some connectivity issue. That's why you are facing some issue.
Okay.
Just reload your page. Yeah. Ma'am, you continue, please. She'll join.
Yeah, thank you so much. And she completed her MD in homeopathy in 2014 and from Sri Guru Nanak Dev Homeopathic Medical College. She also has completed postgraduate diploma in health promotion from National Institute of Health and Welfare, Family Welfare, New Delhi. Currently, she is pursuing PhD in homeopathy from reputed university. She has honored her skills with a personalized training from Dr. Deepak Sharma, and she's taking care of Janakpuri branch of Orbit Clinics. She has over 9+ years of experience in treating very difficult cases, female problems, uterine fibroids, to name few. PCOS, skin ailments, and many more. And she's also working as a medical officer part-time in the field of drug de-addiction with aim to explore the effectiveness of homeopathy in drug addicts and psychiatric patients. She has done an orientation course on drug abuse prevention. There is so much to say. She is the vice president of Delhi Homeopathic Medical Association and actively participates and organizes many CMEs, health camps, events from time to time. She is also working on the post of assistant professor in the Department of Organ of Medicine and Homeopathy Philosophy in a very reputed medical college. She is a recipient of many awards. Recently, she has awarded with Homeo Bhushan Award 2019 and Homeocon Icon Award 2019 from Board of Homeopathic System of Medicine, Delhi, in 264th birth anniversary celebration of Dr. Samuel Hahnemann. She is the core person of our CAF study group. She's always prompt, dedicated, very kind, and make sure all goes well. In one word, I would say I see myself in her. And I'm so fortunate to have Shweta, who makes my life easy and stress-free. Let us welcome Dr. Shweta to our webinar. Thank you so much, Yashika and Dr. Shweta.
Thank you so much, ma'am, for your sweet words. And these are the sweetest words I heard about me. Thank you. And I want to thank Kavitha Holistic Approach and you. And of course, Homeopathy 360 for inviting me, for giving me this opportunity to share my views on homeopathy in dermatology. I want to thank the sweetest Yashika and, of course, the kind and the fighter, Regina ma'am. Thank you so much, all of you.
Cheers.
Shall we
Thank
start
you,
now?
ma'am. Yeah.
Is it visible?
Yes, ma'am, absolutely visible.
So I'm talking about the homeopathy in dermatology, a holistic way of healing today. And first of all, thanks to Kavitha Holistic Approach and Homeopathy 360. And through this, I want to thank Kavitha Kukunoor ma'am, Regina ma'am, Dr. Yashika, and Manish Jain sir for giving me this opportunity. Now let us start. What is dermatology? It is a branch of medicine which deals with the skin diseases as well as hair and nails problems, both the medical and the surgical aspects. If we see the homeopathic view, the skin diseases are the outward expression of what is going on inside. What we see on the surface is only a fragment of disease. It is not the whole disease. It is a reflection of internal dyscrasia or disharmony. You can say diseased vital force. It is serves as a mirror. Skin is like a mirror which reflects the condition of the various internal vital organs disorders. Skin diseases are not simple skin problems, but they are the result of an underlying internal disorder. So it is a dynamic disease that appear on the external surface of the body, but the cause is present internally, causes within. So diseases from the internal, which is reflecting outwards. So diseases from the center, from within to outwards in the case of skin diseases. No disease can be local. As we see in skin diseases, they are present externally, but they are not local disease. They are the dynamic disease, which are because of the which are the outward expression of inward and spiritual vital force that becomes disordered, and it is reflecting the disharmony of the internal vital organs. If we see the talk about the homeopathic treatment, so the patient with skin disease is to be treated as a whole, not only for the skin lesions, not only for the parts where it is affected, not the organs and not the system. We consider patient as a whole, whether it is a skin disease or any other disease. So the constitutional treatment or the anti-miasmatic treatment is the only way for the permanent cure or for the radical cure. And any attempt to alter this expression of disease artificially by any external means is necessarily an act of dishonesty. We have to treat, we have to consider the patient as a whole and not only prescribe on the basis of only the skin lesions. We have to see patient as a whole. For this, as a homeopath, we do in-depth study of a case. We do case taking to individualize. So individualization is the basis of prescription. It is the first step to the simillimum. What is individualization? Individualization means we have to differentiate every single case of the same category, of the same group, from others by some exclusive features. Individualizing features are always available in a curable case. If we are unable to find out these individualizing features in our cases, then those cases are less amenable to cure, they are difficult to cure. So every curable case will present individualizing features in it. It is hidden in the details of your case taking, in the details of the case, whether it is present in the physical journals, whether you can find them in the mental journals, whether in the causation, the ailments from, whether in the past history of the patient, but these are always present if the case is curable. These are hidden treasures in the case. So the homeopath must possess these skills and this art to find out these individualizing features in the particular case. We have to act like a investigating officer to find out those clues from a case to reach to the perfect simillimum. So case taking is required to find out the individualizing features of a case. In aphorism 82, Dr. Hahnemann mentioned that no real cure can take place without a strict particular treatment of each case of the disease. This strict particular treatment refers to the individualization of the case. In aphorism 153, Dr. Hahnemann said, in search for a homeopathic specific remedy, the more striking, singular, uncommon, peculiar, that is, characteristic signs and symptoms of the case of disease are chiefly and most solely to be kept in view. You have to find out these striking symptoms, singular symptoms. You can find out the uncommon, peculiar symptoms, characteristic symptoms of a case in order to find out the particular remedy, the specific remedy for that specific case. So it is the sole aim of the individualization and of the case taking. The more general and undefined symptoms demands but least attention. We do individualization, we do case taking to form a diagnosis and to form a therapeutic diagnosis. So diagnosis is important. The knowledge of disease is important to know the general and common symptoms of a particular case. But individualization is important to find out the therapeutic diagnosis, to find out the remedy. So we give attention to the generals and common symptoms in a case, but it is least required when of that vague and indefinite character. As the common symptoms are present in almost every disease and it is present in almost every drug. Now, the individualization will help you in the selection of the simillimum. The individualizing features in total will form the totality of the symptoms. In aphorism 7, Dr. Henneman said, now, as in a disease from which no manifest exciting or maintaining cause, that is, causa occasionalis, has to be removed, we can perceive nothing but the morbid symptoms. So, to find out this totality of the symptoms or the individualizing features, the peculiar symptoms, characteristic symptoms, first, what should we do? We should exclude the exciting or the maintaining cause that are responsible for the disease, that can be responsible for the disease. So, first task is to do the case taking, to investigate a case, find out what are the exciting factors, what are the maintaining factors for that disease or for any condition. First exclude those, first remove those exciting or maintaining causes that are responsible for causing that disease. Then what left is the quality symptoms that form the totality of the symptom. So totality of the symptom is not the quantitative collection of symptoms, it is the qualitative collection of the symptoms. And the totality of the symptoms is the outwardly reflected picture of the internal essence of the disease that forms the disease, that is of the affection of the vital force, that shows the disordered vital force in a whole way. And it should be the principle, it must be the principle or the sole means where by the disease can make known what remedy it requires. Then you have to find out the this remedy on the basis of that totality of the symptoms. It is the only thing that can determine the choice of the most appropriate remedy, and thus, in a word, the totality of the symptoms must be the principle. These are the saying of Dr. Henneman in Organon of Medicine in Aphorism 7. So, what we understand, that totality of the symptom is a fully broad term. It considered everything that is essential to know about the disease. It is everything that is visible, that we perceive through our senses, that we perceive through by touch, by smell, by seeing anything, by listening to anything. So this is everything that enables the physician to understand the phenomena of disease in human beings, that is required to individualize between the disease of the same category and between the remedies. Now, so we can say this totality of the symptoms is the entire representation of the disease or the drug. How we will form this totality of the symptoms? As I told you that these are the individualizing features, are the treasures that are hidden in the case. So where we can find those treasures? We can find in skin diseases, the totality of the symptoms can be based upon the location. You can find a particular location which will help you in finding the suitable remedy. It can be the sensation, peculiar sensation. It can be the modalities. What are the aggravating factors? What are the amelioration factors? It can be the concomitants. It can be the accompanied complaints which are not physiologically and pathologically related to the main complaint, to the chief complaints. Then you can find these clues in the physical generals of the patient. Like it can be something in the appetite, it can be in the differentiating features of thirst, it can be in physical general, sleep and other factors. And one more thing, that is mental generals. You can find these things in the mental status of the patient. You can also consider the past history of the patient. You can ask the family history of the patient, and the causations, everything is important. So it can what you find in these things can individualizing features, peculiar, that will form the totality of the symptoms. Then treatment, that is cure. Cure is also within outward. As we see Constantine Herring's law of cure, it is the cure will takes place from within outwards. Means from the more vital organs to the it will the disease will the cure will travel from the more vital organs to the least vital organs. It will be from within outward, it will be from above to downwards, it will be from the in the reverse order of their appearance. So what are any skin eruptions which appear recently will go first, then the last eruption will go later on. It cure will follow this path. About the external applications, Dr. Hanneman said that it may seem as if cure process of a local disease could be accelerated with correctly chosen homeopathic remedy, internally as well as externally, selected on the basis of totality of the symptoms. It might possible produce a more rapid improvement. It might seem to us that if we find out a simillimum and if we give that simillimum externally, internally and externally both way, then the results may be more rapid. There can be more rapid improvement in that case, but it is not advisable. Dr. Henneman's teaching in Aphorism 194, he said, it is neither beneficial in acute diseases of rapid growth, nor in those of long standing, nor in the chronic diseases to use a remedy externally as a local application to the diseased part, even if the medicines were specific and curative in that form. So it is not advisable from our master, Dr. Henneman, to give the external treatment or for the external application of the remedy, even if it is the simillimum. External application, then it is the entirely objectionable treatment. If we give the simillimum in with the external application, there will be premature disappearance of the local symptoms of the external symptoms, and it will be difficult for us to assess that the disease being totally exterminated. There can be a retrograde change, means the change can be in the inward direction, and it can affect the more white. It can it may be disappeared from the external, but it may get into the internal directions and it will affect the more vital organs. So it will get suppressed and it will take more graver form. Now the cases. This is the first case of ringworm tinea. A male patient aged 48 years came with the itching eruptions since 3 weeks. Location, as you can see in the picture, it is upper chest, right sided, and the sensation is itching. There is violent itching and burning after scratching. So scratching aggravates. The aggravation is also from the undressing. In the physical generals, the appetite was average. He takes 3 meals a day. Desire was peculiar, that is sweets, and 2 grade intensity. And thirst is decreased, 1 to 2 glass per day. Perspiration is characteristic. He got sweating more over the palms. Tongue is clean and moist. Thermals are this patient is hot patient. Now on repertorization, I took eruptions herpetic, that is for the ringworm, eruption ringworm, that is same herpetic, and outer chest eruptions herpetic, itching undressing aggravates, sweet desires, clean clear tongue, and perspiration on palms, hands. So the remedies that came up are sulfur, mercurius, sepia, arsenic, and rust ox. I chose sulfur 30. I gave single dose followed by placebo. So why sulfur? Sulfur, because everything is covered by it, every peculiar symptoms was covered by it. Mercurius, in mercurius patient there is increased salivation. Here the tongue is clean and moist, but there is no increased salivation. In mercury patient, the thirst is increased. There is intense thirst. But in sulfur patient, the thirst is not so marked. The mercury patient is chilly, whether the sulfur patient is hot, and our patient is hot. He has desire for sweets, which and there is tongue is clean and moist, not that intense thirst is there, no increased salivation is there. And if we compare sulfur from sepia, so in sepia there is itching which ameliorated by scratching. It has that burning after scratching like sulfur, but it is not ameliorated, it is not aggravated after scratching. In sepia patients, skin complaints better by dancing or by doing exertion, by perspiration. The tongue of sepia is basically foul, and it becomes clean at the menstrual nisus and returns back when flow stops. But in our patient, the tongue is clean throughout. Sepia patient has indifference. Our patient is not that indifferent or indolent, and sepia is chilly, but our patient is hot. So I selected sulfur over mercury and sepia. If we talk about arsenic patient is better. Skin complaints are better by warmth and aggravated by cold. Arsenic also covers the symptom of aggravation, undressing, but there is in the mental status, there is no such anxiety, no such fear or restlessness or frustration I found in my patient. There is increased thirst in arsenic. He wants cold water in frequent intervals, in small quantities, in sips, but the patient has increased thirst. And moreover, arsenic is also chilly patient, but my patient is hot. So everything is over these remedies, I chose sulfur, which is a hot patient. So I gave sulfur in 30 potency single dose, followed by placebo TDS, and for 15 days. And the results are, in 15 days, the eruptions got cleared with a single dose of sulfur 30. Next case is of Leucoderma. You can see some ringworm over the arms, over the forearms. So this is a case of tinea infection with Leucoderma. A male aged 28 years came to me for his skin problems with much itching. These eruptions leaves hypopigmented spots afterwards. Location is, it starts from lips, then appear at upper limbs. Sensation was, there was intense itching and burning. Aggravation is night, more on perspiration and dampness. Amelioration is from scratching. In physical generals, appetite was average, thirst is increased, desire for non-veg, tongue is spotted white with red edges, the margins are red, and sweat is increased, which aggravates his condition. Thermal reaction is a hot patient. At that time, there was a rainy season. So with his symptoms, in his eruptions, there is redness, there is intense itching, which aggravates because of this rainy season, because of dampness. So at that time, I chose Rustox to give. I gave Rustox 30 BD for a week. Then on follow-up, after 1 week, that tinea spots, that tinea eruptions got disappeared, but the hypopigmented spots over the lips, over the hands, forearms, it is there, still there. Then in the follow-up, improvement is seen. Eruptions were almost cleared up, but hypopigmented spots still present. So on further investigation, I got to know that in family history, his grandmother is asthmatic. She has breathing difficulty, and in mentals, I find fear from dogs, which is very marked. This is the I this is a specific question I asked him. Uh, then second prescription, I gave Basilinum 200 one dose, a nosode intercurrently, followed by placebo. I thought that Rustox has done its role, so I chose Basilinum 200, and the improvement after 3 months is the hypopigmented spots are mostly cleared up. There is little, you can see the pigmented spots over the forearm are cleared up. There are little 1 or 2 spots are still there, and the pigmentation over the lips is still there. So as I told you, the direction of cure, it will be his hypopigmented spots are started from the lips, and in the direction of cure, it will be cleared up at the end. Remedy analysis. Why Basilinum? I want to tell you the difference between the Basilinum and the tuberculinum as an intercurrent. Basilinum has more affinity for the ringworm affections. Ringworm infestations are more in Basilinum, while in tuberculinum, the eruptions will be red and there will be flushed skin. There will be congestions. There is venous plethora around the eruptions of Basilinum patient. You can find bluish discoloration, venous plethora around the eruptions of Basilinum. And in tuberculinum, you will find eruptions, skin eruptions at the bend of joints. Sphere of action, the in Basilinum, the remedy acts more over the base of lungs, while in tuberculinum, it has more affinity for you will find more affections of the throat. That is, you can find tonsillitis and etc. Miasm, there is tuberculocycotic miasm. As it is affecting the base of lungs, there will be increased mucus, etc. And the miasm in the tuberculinum is tuberculosyphilitic. The patient, if you see the mental status of the tuberculinum patient, he is very much destructive. He is stubborn. He is very impatient. There are temper tantrums like I want this, I want that, and he's very aggressive. And there is fear of dogs in both the remedies. But the Basilinum patient is a little irritable. He is only irritable, but you can find a lot of tantrums in the tuberculinum patient. The Basilinum patient is hot patient, while the tuberculinum patient is chilly. So I chose Basilinum as a nosode, and I gave that in 200 potency, because nosodes, I heard somewhere that nosode should be used in high potency. So I chose that medium potency 200 to be given, and these are the results. I have not used any remedy in between these 3 months, and these are the pictures. 1 dose of Basilinum 200 worked so well in this case. Now this is a case of what? A tall, middle-aged male patient came to me with a complaint of a wart. There is a single wart located over his left thigh. That is, it is very painful. Associated complaints. Previously, there is aching pains in the extremities, which are persistent since long. The patient is keep coming to me time to time for the pain in extremities, for the weakness he feels, so which aggravates while rest and amelioration by motion. Treatment, he was taking painkillers on and off for that pain in extremities. Homeopathic treatment, I gave 1 or 2 times, I gave Rustox, which gave little relief, but the treatment was not continued. Then the patient came to me for this wart. In the personal history and the general history, there was addiction to tobacco, and on investigating further, there is aversion to tea, which is very marked. Both the things are very marked in this case. On repertorization, I took these symptoms: wart large, wart painful, lower limbs, food and drinks, tobacco desires, and tea aversion. These are the symptoms which I took to repertorize. And the remedy which cover all the symptoms is Thuja. Analysis for the remedy. Thuja is basically an antipsychotic remedy. It is principally worked on the left side. There is aching pains. On further, when I refer the materia medica, I found aching pains that increases so long as he keeps still. He's compelled to keep the bed and then constantly moves and turns. This is like somewhat like Rustox. So such symptom would be cured by Rustox when the case is not psychotic. When the case is not psychotic, in those aching pains, Rustox will work. But when these symptoms come from suppressed gonorrhea, Medorinum or Thuja will cure. It is by Dr. Kent. You can find these lines in Kent Materia Medica. And because our patient turns into psychotic miasm, there is a wart which belongs to psychotic miasm. I chose Thuja to be given, and it is the remedy which comes upon repertorization also. So I gave Thuja 200 single dose, and this is the video testimonial. It is not working. Dr. Yashika? Okay, this is the video testimonial from my patient. This wart shed off in just 1 week, 6 to 7 days after giving Thuja 200 one dose. So single doses has worked so well in this case of wart. Now this is a case of atopic dermatitis. It is a case of 2 months old baby girl. You can see the horrible condition of her skin in the picture. So now on observation only, you can see the condition of the picture. There is moist skin eruptions. There is copious serous exudations, and there is thick leather-like crust under which thick and white pus collects here and there. Hair is glued and mated together, as you can see, and there is offensiveness is there. And on further inquiry to the mother, it is found that she had these eruptions after giving vaccine. All this picture of this baby is given in Allen's Materia Medica in the medicine that is Miserium, which is covering all these symptoms and the condition of this baby. So I gave, without giving any second thought at that time, I gave Miserium 30 single dose and you can see the results. The baby came on 3rd January 2020, and the eruptions are cleared on 8th January 2020 with a single dose of Mesarium 30. The last case, a case of Urticaria, a lady aged 39 years complains of swelling over her lips, recurring since many years. She had this problem, she had this complaint of swelling over her lips, sometimes upper lip, sometimes lower, sometimes both. And since many years she was suffering from this complaint, and there is a sensation, a pricking sensation with this swelling, and aggravation is in the morning. Mostly this swelling appears in morning. Associated complaints were cracked skin of palmar surface of hands, more tips of fingers, with itching and pain. There is chronic recurrence of the pain in chest, which aggravate on taking anything cold things. In physical generals, appetite was normal. She takes 3 meals a day. Thirst was normal. Desire salty, and stool was unsatisfactory. There's constipation, hard stool, burning sensation after stool. Urine was offensive, frothy occasionally. Tongue is coated white on observation. Sleep is little disturbed, and thermal reaction is she's a hot patient. Menses were regular, and there is a complaint of leucorrhea that is profuse, thick, pale yellow in color, and acrid. It is with itching over the genitals, and leucorrhea is aggravated while urination. Then in the mental generals, there is irritability with the weeping tendency, and the patient is very emotional. She has a history of there is grief due to the death of her husband a few years back. On repertorial analysis, on repertorization, we got these remedies: Natramur, which is covering 7 symptoms out of 10, and Causticum, covering 6 symptoms out of 10, Graphitis, and sulfur. So if we see the patient, Natramur, she is a hot patient, Causticum is chilly, Graphitis is also chilly, sulfur is hot. And sulfur, if you differentiate, Natramur has a desire for salty things, but on the contrary, sulfur has a strong desire for sweets. And in Natramur, there is irritability, there is weeping tendency, there is consolation aggravates, and contradiction aggravates. While if we see Causticum, the patient is highly, intensely sympathetic. There is, if we see the grief part, so grief is covered by Ignitia for the, if there is acute grief, or Natramur staff, if we consider grief, Natramur staff. But Causticum is also a wonderful remedy when there is weight loss due to the prolonged grief, so or worry. But Causticum is chilly. There is in Natramur, there is salty desire. Causticum is also salty, but the mental state doesn't match with our patient of Causticum. And in Graphitis is chilly. She's a fatty lady. There is a night aggravation in Graphitis. She's like pulsatilla. She's timid. She doesn't unable to decide anything. And if we talk about the skin eruptions, Graphitis, in skin eruptions, there is sticky watery discharge is there, which is very peculiar in Graphitis patient. So if we talk about the sulfur patient, there is a dryness, more towards dryness. There is burning after scratching. The patient mental status, he's very he's very dirty, filthy patient who doesn't like to bathe, aversion to bathing, and he's stoops shoulder patient, and rags seem beautiful to him. So more the patient is constitution and the complaints and the physical generals are more likely towards natramute. So I gave natramute to my patient. Natramute 200 single dose followed by placebo for a week, and since then I took her testimonial today only, where she said that there is no swelling recurrence since 1 year. Since that dose I gave to her, Natramute 200, there is no swelling, no arterial eruption over the lips since then, since it is about 1 year. One more thing I would like to tell, that in case taking, when you consider the physical generals and mental generals, my prescription, yeah, or my likeliness is towards the physical generals, because if the analysis of physical generals is same for one physician, one homeopath to the other, but the analysis in the mental generals may differ. I can perceive anything about the mental status of the patient. Anybody else can perceive something different. So I gave more importance to the physical generals rather than the mental generals in my prescription, and that is giving me the results. So thank you so much. This is the video testimonial. I'm sorry, I'm unable to.
Ma'am, can you do me a favor? This will be played if you share your screen. You can share the screen and turn on this video in your computer, and then it will be audible as well as visible also.
Okay, sure.
There is an option of screen share in
Okay.
just above the presentation. Yeah.
Okay then. Is it visible?
Yes, ma'am, it's visible.
Okay, great.
Just turn your volume full, like the volume of your computer full must be full, and then you can begin the video.
Okay.
काफी टाइम से मुझे स्वेलिंग आती थी, तो मुझे कई डॉक्टरों को दिखाया मैंने, लेकिन उसको कुछ आराम नहीं पड़ा। तो मैंने डॉक्टर श्वेता को दिखाया, और जो भी मुझे दवाइयाँ दी हैं मैंने खाई है, पूरा ट्रीटमेंट करा था उन्होंने। तो ट्रीटमेंट से मुझे काफी आराम पड़ा, लेकिन अब 1 साल से मुझे कोई भी स्वेलिंग नहीं आ रही है। मैं बहुत ठीक हूँ।
I would like to share the previous video of that ward case.
राधे राधे। मेरा नाम घनश्याम है। मेरे जांघों के बीच के अंदर एक मस्सा हुआ था जो मुझे बहुत परेशान कर रहा था। तो मैंने डॉक्टर श्वेता से दवाई ली। दवाई लेने के 6 या 7 दिन बाद वो अपने आप ही टूट के गिर गया। अब मुझे आराम है, किसी प्रकार की कोई दिक्कत नहीं है।
Okay, as you saw this video of that ward case, you can see that the patient is chewing the tobacco while making this video also. So this is very marked in that this patient, and I took this symptom in repertorization for his ward. I took desire for tobacco. This is the reason I took this symptom, and that's all about my presentation today. Thank you all of you for listening me with so much patience. Thanks a lot.
Thank you so much, ma'am. It was such a wonderful presentation. I hope everybody enjoyed it, and we are getting so many comments. There are queries also. With your permission, can we discuss one query? Then we can have a discussion with Dr. Kavitha ma'am and Regina ma'am. There
Yes,
are
if
two, three questions. Can we discuss first?
yes,
Yeah.
yes,
Thank
please.
you so much, ma'am. The first question was from Dr. Robin. Herpes is a virus and ringworm is a fungus. How did you feel comfortable using herpetic eruptions in your repertorization?
Actually, I saw this symptom in the Kent repertory, and there was given I saw a ringworm, and in the bracket I got a herpetic eruption. So I refer that rubric.
Thank you so much, ma'am. There is one more question. Can you please describe the theory about vitiligo and its treatment in short? Dr.
Uh,
Tong wants to. Or you
I
can just explain the difference between Leucoderma and vitiligo. Also, he wants to know.
Yes, that was leucoderma as because it is because of these infections or that ringworm. After that infection or there is hypopigmented spots. There it is because of the some injury, and it can be because of some allergy to something, any any cosmetics or something, that if we found these hypopigmented spots after such injury or some allergic reactions, that is known as leucoderma. While vitiligo is hypopigmentation, it is basically from the genetics.
Thank you, ma'am. Any other queries from the audience? By the time we have Dr. Regina ma'am and Dr. Kavitha ma'am with us. You want to say something, Dr. Regina ma'am?
Congratulations, Dr. Shweta. It was a wonderful presentation, well put, and the case studies are very inspirational to us. We learn a lot from you.
Thank you so much,
We
ma'am.
look forward to next time hearing from you with other case studies as bright and as these ones. Many blessings to you. Congratulations for such a wonderful practice.
Thank you so much, ma'am.
Namaskaram.
Thank you so much, ma'am. We have Dr. Kavitha ma'am also. Ma'am, you want to say something?
Amazing cures, Dr. Sweta, with single remedy and the way you are so nice and easy way of learning, and it was awesome. And the cures are really great and inspiring that there is lot of cures can be done with homeopathy. So
Thank you.
that was so nice. And is Dr. Deepak also here, Dr. Yashika, along with us?
I think so, ma'am is also here. Yes, sir. Welcome,
Yeah.
sir. We have Dr. Deepak Sharma, sir, with us. So,
Thank you.
thank
Thank
you
you,
for
Dr.
joining us.
Ashwin.
You want to
Uh,
say something about today's
yes,
session?
it was really a wonderful session, Dr. Shweta, and you are doing a wonderful job on the skin cases in our orbit clinics. And I want to share the answer of the question of the Chaju Ram Tong, who is asking, please describe the theory about the vitiligo and its treatment. Actually, what I want to say about this vitiligo, many of the doctors of the from the modern medicine and from other medicines, they are thinking about the genetic problem of that disease. But actually, we have many cases in which the first presentation is coming with the same patient of the vitiligo. So there is no genetics involved in that cases. So we treated it like a theory of the separation. This is the wonderful theory I got from many books that the separation theory of separation is like a you separate from your lover ones, you separate from the family that causes the vitiligo like problems or the hyperpigmented. So this is one of the theory I accepted, and I always search the medicine according to that. And homeopathy is wonderfully act when you get the history of like separation, as Dr. Shweta tell, the individualization is must. So in vitiligo cases, I always use the theory of separation, and it gives a wonderful result. So Dr. Shweta, you beautifully present all the cases. Thank you so much. And thank you, Dr. Yashika. Thank you, Dr. Kavitha. Thank you, Professor Rajina ma'am. Thank you so much.
Thank you
Thank
so
you so
much,
much.
sir, for sharing your comments. We have a query, ma'am. If you want to discuss one more query, is there from Dr. Ashok Madan, sir? He wants to ask. There is a patient who is diagnosed with urticaria. On repertorization, I think he got natramure, phosphorus, and sepia. He had desire for salts, but the patient is chilly. Can you please comment or advise something?
If the patient has desire for salts and he's a chilly patient, please go for the mental status also. And phosphorus will be the remedy because it covers that chilliness and desire for salt. So instead of natramure, you can go for phosphorus.
Thank you so much, ma'am. I hope the query of Dr. Madan was cleared. Any other queries from the audience? Ma'am, you want to say something, Kavitha, ma'am? Or you want to ask any query?
No, we will refer skin conditions to Dr. Shweta and Orbit's clinic because they're doing amazing job, especially with the vitiligo cases as where it has been there for several years. And in such cases, again, as Dr. Deepak has said, like the suppressions, the mind symptoms. So definitely, it is a good thing that these documentation of these cases really helps when they see this recording. They think that hope that homeopathy can help, and we can refer to the practitioners who have already treated. So that is a good way of getting the client referrals too. And we have tomorrow with Dr. Deepak on PCOS at our CA webinar series.
Yeah, so I was about to announce that we have a session by Dr. Deepak Sharma sir tomorrow for the very first time, I think, on the platform of Homeopathy 360 also. We are glad to have him tomorrow. I hope everybody will join us tomorrow again for the session at 8:30 p.m. We'll be discussing about polycystic ovarian syndrome, and Dr. Deepak Sharma sir will be taking the session. There are any other queries which you want to discuss? Yeah, there is one question. I think that's a contradictory question. If you want to answer, then only you answer. Otherwise, you can answer in person also, ma'am. From Dr. Hetal, can you comment on patent homeopathic applications which are available for skin conditions? And
Patent.
there are many patent homeopathic medications applications which are coming up, which are available. So you want to comment on this? That's perfectly your call. If you want to discuss here or on person in person.
I have already discussed about the external applications and the views of Dr. Henneman. I personally do not use any external applications, but people are doing it and they are getting wonderful results. So it is your way. The main aim is to relieve the patient. I do not want to comment on others. If they are using that, that is their choice, and they are, if they are getting good results, if they are curing the patients, they can use. Thank you.
Thank you so much, ma'am, for such a nice answer and clarifying that query so beautifully. Ma'am, there is another question from Dr. Mukta Garg. What about ASF, arsenic sulflavum 3x in vitiligo cases?
Actually, I didn't get any results from ASF 3x or 6x. I usually go for constitutional remedies and with the symptoms, with the physical journals and all the histories and all. I go with these things in my case taking. ASF in specific didn't give any results to me.
Have you
Thank you so
tried
much, ma'am.
antimonium
Yeah.
crudum 3x or 6x? Sweta, have you tried
Yes,
antimonium
ma'am.
crudum?
I tried. Yes, yes.
Here is a suggestion, Dr. Shweta. Please change the company of that potency. You will get the
Okay.
result.
Sure, sir. Sure. Definitely. I'll use BHMS.
Okay. Good.
Ma'am, actually, there is a in my during my internship, I've also seen many good results with arsenic sulflavum. We have a project running in Nehru Homeopathic Medical College on especially on vitiligo, and their maximum patients, according to their philosophy being made, they are treating patients, the project in charges, and they are getting wonderful results with arsenic sulflavum in 3x and 6x potency. Like I myself have seen the patients improving. So yes, like I can say this.
Definitely.
Maybe your
I'll change
suggestion is
the company.
And with respect to warts, I was asking that antimonium crudum 3x and 6x. So I just wanted to know how many of them are using that along with the constitutional defecting remedy antimonium crudum. So in this practice, so
Antimonium
they
crude is
success.
a wonderful remedy, ma'am. Yes, definitely. It is a wonderful remedy for cons and, of course, warts. And I haven't used in 3x or 6x, but 30 I used. And it gave me wonderful results.
Very nice.
okay. So I think we come to the end of this session of the day. We have one more question from Dr. Mukta. Role of Bapsi oil in, I think, vitiligo. She wants to know.
Yes, it is wonderful. It gives results.
Okay, ma'am. So I hope all the queries of the audience absolutely cleared. We come to the end of the session of the day. Want to request our dignitaries, Dr. Deepak Sharma sir, Dr. Kavitha ma'am, and Professor Regina ma'am, if you want to say something for today's session, um, you can continue. You want to say something, Kavitha ma'am or Deepak sir?
Yeah, go ahead, Deepak.
Thank you so much, Dr. Yashika, for organizing this type of excellent webinars. And this is, I know about Dr. Shweta because she's working with us and she's really expert in the skin cases and the uterine fibroid cases. We at all centers, we are giving all cases of skin and uterine fibroid to her. So this is wonderful, Dr. Shweta. We will correct a few things in next presentation. Thank you.
Definitely, sir.
Thank you so
Thank you
much.
so
Thank you,
much.
Dr. Yashika. Thank you, Dr. Kavita. Thank you, Dr. Regina.
Thank you so much, sir. Ma'am, with your permission, can we end this session of today so that we can join everybody tomorrow again?
But I thank sincerely Dr. Yashka for this great opportunity and Manish Jain and Homeopathy 360 for giving us this opportunity to present the KHA webinar series. And please visit for all the updates homeopathy360.com and all the future webinars and everything, even kavithahomeo.com. We have upcoming webinars which are HMA approved and on the homeo prophylaxis. So, thank you, Dr. Shweta, for the wonderful session, and we look forward to have more from you. And Professor
Thank you so
Regina,
much.
thank you.
Thank you
Dr.
so much,
Yashka.
ma'am. So, yeah, thank you so much. Thank you, everybody. Thank you, audience, for your patient listening. We'll join you back tomorrow at 8:30. Also, I want to announce that we have a webinar series tomorrow in the afternoon. Also, starting from tomorrow, in the memory of Dr. B. Sahani sir on his death anniversary. This week we are organizing a webinar series with Dr. B. Sahani sir, Dr. M. K. Sahani sir. So you for any details you can visit the website of homeopathy360.com. We'll be starting the webinar from 1 o'clock to 3 o'clock, and we have great speakers coming up. We'll be discussing about different philosophies, and tomorrow we are going to have Dr. Brian Kaplan sir with us and Dr. L.M. Khan sir with us. So I hope if you want to learn from Dr. Brian Kaplan sir and Dr. Eddie Khan sir, so you can join us in the series tomorrow. I'll post the link if anybody wants to register. And also we'll be coming back tomorrow again at 8:30 p.m. with Dr. Deepak Sharma sir on PCOS. So we hope you all will join us tomorrow again. Thank you so much, everybody. Thank you, Shweta ma'am, for such a wonderful session. Dr. Kavitha ma'am,
Thank
Dr.
you,
Deepak
Dr.
sir, and
Yashika.
Regina ma'am for joining us
Thank
today.
you, all of
Thank
you.
you so much. For
Thank
any
you, Dr.
queries,
Yash.
I would request the audience to kindly mail us at webinar@homeopathy360.com. I have posted the link of tomorrow's webinar of Dr. Brian Kaplan sir and Dr. LM Khan sir. Also, we have Dr. Prakash Kwenkal sir from Nepal, who will be discussing about the discovery of hair transmission and everything related to Dr. B. Sahani sir. So you can join us back. You can find the details in the chat box. So thank you, everybody. Thank you, ma'am. Thank you, ma'am. Thank
Thank
you.
you. Thank you.
There is one last question. If you want to discuss, there is one more question which have come up. In severe itching, any external application we can use in severe itching?
I
I'll
don't know.
I'll just I'll just suggest Dr. Suryakanta, please use coconut oil. That is one of the safest thing that will relief to the patient, give relief to the patient. Plus, do not hamper the effect of homeopathic medicine. So I
Yes.
think your doubt is cleared. Thank
I,
you so
I want
much.
to I want to add, please
Yes,
don't use coconut oil in cases of psoriasis or
yes,
where
yes,
there is any discharge from the eruptions. Please avoid
yes.
coconut oil or any moisturizer in those cases, except you can use.
Yes, ma'am. Thank you so much. So I hope everybody's doubt is clear. Thank you so much, ma'am. Thank you, Kavita ma'am. Thank you, Regina ma'am. Thank you, Deepak sir.
Thank you, Dr. Yash.